Okay. We have a caller, and she's actually a guest, and she's a former patient. I still keep track of my former patients, see what happens to them. So, Deborah, are you there?
Yes, I am. How are
Hi. How you? We're doing okay. How about you?
Good.
Okay. Well, we want you to tell us your story, starting from the beginning where all of this mess started.
Okay. Okay, well, it's quite the journey and quite the maze, and so I actually asked my husband to be a part of this because there may be something that I missed, or maybe, he thinks something to elaborate on or interject. But
Okay, you want to introduce him?
well, it's Ron.
Hello. Hi, Doc. How you
Hi.
Mm-hmm.
I'm doing okay. How about you? How's your motorcycle?
doing great.
Your
I was
motorcycle?
cleaning it up. She made me come in to get on the phone.
Sorry about that.
Okay. All right.
And, just for your viewers, these are real people, real stories, not a fabricated thing. I wish it was, but it's not.
And it's not the webmaster saying it, right?
No, it's not. Far from it, no. Well, here's the cancer story of mine. Actually, all of my situations started out before 2002. I was actually diagnosed with endometriosis. And I was on a lot of birth control pills for years. And it was some kind of a strange regime that they had going back then, that you would stay on the birth control pills. I mean, you could be on them for 2, 3, 4, 5 months, and then finally only would you come off of them if you had a breakthrough in bleeding to say, yeah, I've really got a period here. And then you would only be off for 3 days, in which you would go right back on, and you would just stay again, however many days, months, or however long that went. Well, the problem with all this is I had a cyst that formed on my ovary. And now, hindsight from what this taught me was from those huge amounts of birth control pills, it had to have been doing something in my body. So I was finally, I actually had to have surgery in 2002 to remove that. Well, what started out, to be just removal of a cyst became a complete hysterectomy in 2002. So is there anything, Ronnie, you want to have to say on anything so far? Leave anything else?
No, it's all bad, but go ahead.
All right, well, we're good. Okay. So, so I had hormonal problems after that, needless to say. I don't know where my brain was, but after that surgery, I bet it wasn't 3 weeks, 4 weeks, and I had major problems with, when your hormones are whacked out and messed up and you don't have enough things, to balance, well, you're in trouble. So, Premarin, and, that's the first thing, and I couldn't take that. I had major problems with it, hot flashes, all kinds of other things. And besides that, I'm a real naturalist anyway, so I was looking for other things. I was put on Primrose for a while, but I was also introduced to a compounded plant-based estrogen, and that worked out for a while. Well, in 2004, I detected an enlarged lymph node under one of my armpits, and a mammogram was found to have showed a thickening, and it turned out that by a biopsy that it was estrogen receptor cancer that was diagnosed at stage 4 breast cancer. So. And I had CT scans, MRIs, and so forth, and it showed a 2-centimeter spot that was at the back of my back breast wall there. And so now...
And they called that stage 4?
Now I'm told, get off all estrogen, stop everything. So, with that said, that was telling me that, man, that just confirmed what I was thinking, that it was just, estrogen, was loading up on my body. Now, I'm not a physician, but it doesn't take rocket science, I think, to figure some of this out. as you go along. And so...
we got a break. Deborah, we got a break coming up.
Okay.
Don't go away.
Okay,
And we continue the story. Okay. Okay. All right. Okay, Deborah, we left it off that you were diagnosed with breast cancer.
Correct. Yes. And, and that's when I was told to get off all estrogen. And like I had said earlier, I was, I like to do things more naturally without drugs if I possibly can. And so I wasn't on any form of medication at all except this stuff that I had going on with my estrogen problems. So okay. So then a call came from my primary doctor's office, and I was told that I would be going to the oncologist's office and that I would do, exactly what I was told to do from that point on. Well, that right there, that didn't sit with me very good to hear that kind of noise. I thought we kind of had free choice and free will in life, but that was something that I was told right up front. It just didn't sit right with me. So anyway, all right, at the oncology office, I was given the options of, right off the bat, a double mastectomy with chemo and radiation. And these were my survival rates that I remember. It was 55% survival rate, living 5 years with doing nothing, 60% 5-year rate of living doing chemo and radiation, and 65% survival over 5 years for doing all three, the removal of the breast, chemo, and radiation. So as we're in the room, and we were surrounded by, as I remember, there were 4 doctors and a radiologist, my husband and myself. I don't know, something just came over me at that time in my spirit, and it was like a sense of urgency to just get out of there, that I could do this with God. And that's exactly what I did. So we left. And that's what I've been doing ever since. So now, last week, I want to point out that last week was the first time that I listened to your radio program, which was pretty informative and kind of a hoot also. But I remember it was this doctor that was on, and she said to beware of alternative, side of things and the charlatans that you can find lurking about, in that area too. And so here's my story on that take of things. Now, again, you'll always find that I'll be searching out the alternative of things just because I like natural things for my body. I've always found that works best. But this is just one of those stories that you have to hear. All right. So all of this was, first of all, this is a personal battle. You have to decide what your weaponry is that you're going to use, and then you just go with it. So I was led to go to a Chinese doctor, and so from 2002 to 2008, I drove 2.5 hours from my home to this office, having all kinds of, different alternative treatments, ozone, oxygen, and, of course, all of his different supplements that he sold. So that was a great expense out of my pocket. And so here we are, thousands of dollars later, and this is in June of 2008, and he proceeds to tell me that there is no more that he can do for me. He said I should go get my breast taken off and have chemo and radiation, and if you think this wasn't a shock to me and my system and what went on, it was crazy. So now, okay, it's July, and I go to Houston to a doctor there to have a thermography test done. And I was actually told that I had, first he told me I had 6 months to live. And he loaded me up with a bunch of supplements and $1,500, by the way, of Mona V juice, which not only doesn't work, but, and people need to know this, but the expiration date went out before I could even get it all used, and the company refused to take it back. So that was a fiasco in itself. So So, I had been actually covering all my bases in the meantime. I had read numerous articles, books, anything that I could pick up on cancer. I had literally changed, my lifestyle of eating. I ate only foods, that were good, and I don't do well on junk food and so forth. So I was just making changes. But most of all, I had done a lot of reading, and my husband had gone into the internet a lot and just, checking out and trying to decide what would be the best way to handle all this. So as we had and by the way, I did call the doctor that did this thermography for me and back for, I had a question, and now he tells me I've got 3 months to live. So, okay. So, again, we've been covering all our bases. We've been, doing our reading and checking through things. But as we were driving home from that visit in Houston, it was just a lot of trauma and drama. It was just, everything was coming down, so I had found something in the internet, and it was, this was on an alternative thing in San Salvador website, and they claimed that there would be healing by bromelain injections, but the sad thing that took place there was the very person that I was talking to had an investment in the company. And we never found, what was that you found on that line?
Well, they when she got a hold of the doctor's place down there, they gave her this girl's telephone number in California, that she was a former patient, to call her and ask her what she thought about. Well, she talked to her, I don't know, probably 10 different times. The girl would call her, and she'd call back out there, and this went on for a couple of weeks, that they were doing stuff back and forth, and the girl claimed that she'd already had this treatment 3 or 4 times for different types of cancer, and how wonderful it was and how it was healing her. And I'm thinking, well, if it's healing you, why do you keep going back for more cancer? Well, before the thing was over, we found out that she actually worked for the company and probably had never had any treatments anyway. I can't prove that, but that's kind of what it sounded like. I investigated as much as I could on the internet, just trying to find different comments or whatever about it. I couldn't find a single thing on there good about this product, and Deborah was packing her bag. She was desperate. She was going to go. I mean, she told me that she was going, that that's what was going to save her life, and I'm sitting there thinking, no, this doesn't sound right. And I actually found Dr. Carpenter's website by accident while I was investigating this place, and it was just on a different website where they were doing comments on alternative cancer treatments. And there was a big blog in there about this place in San Salvador and how dangerous it was, and there hadn't been any good results actually reported from any of this stuff, that blah, blah, blah. And then the guy went on to say, but there are some promising new treatments out there, and Lase Med was one of them, and that's when I got and found the website on that and got to looking at it. And it was kind of backwards from what I'd been looking at most everything else. I couldn't find anything negative about it. So
back then,
I talked to Deborah about it, and this was back in 2008, and there wasn't anything that was just really would slap you in the face about don't even think about doing this. There was a lot of promising talk about it, and that's why I sat her down and talked to her about it, that maybe this is something we needed to look at.
Yes, and then we slept on it, and actually, because I got in and I looked at it too, and it looked really good, and so I called to you, Dr. Carpenter, the next morning, actually, after we had checked your website out, and can you believe I actually got to talk to you, the doctor? So that was pretty amazing to me. So I asked you, I know, a lot of questions, and some of them are probably pretty stupid, but you know what? To me, they meant everything. And then you gave me, I was given a list of patients to talk to,